Good afternoon, everyone, and welcome to PiXight, our new webinar series on imaging and AI innovation in rheumatology. My name is François Bonnet. I'm a scientific program manager at the Medical University of Vienna, and I will be moderating today's session entitled Why AutoPiX? But before we start, I'd like to welcome our guest presenters today. Today with us, we have Peter Mandel, Peter Böhm, and Rob Janisek. Peter Mandel is an associate professor of rheumatology at the Medical University of Vienna. He leads a group focusing on imaging in arthritis and other musculoskeletal diseases, and is very active in international rheumatology and imaging networks. Peter is also, together with Daniel Aletaja, the project coordinator of AutoPiX. I also want to welcome Peter Böhm, who brings his perspective as a patient research partner in AutoPiX. This means Peter helps ensure that projects like AutoPiX stay closely aligned with the needs and perspectives of people living with rheumatic diseases. Finally, Rob Janisek works in immunology imaging at Johnson & Johnson and is our project leader. Rob provides the AutoPiX project with a perspective from our industry partners and has been closely involved in projects like AutoPiX, helping connect scientific advances with real-world applications. So with that, I'm delighted to have all three of you with us for this first PiXight episode, in which we'll answer the question, why AutoPiX? A quick message to the audience on YouTube. Let's now immediately start with a few slides from Peter Mandel. Peter, over to you.
Thank you very much, François, and a warm welcome to all of you in the panel, and of course, all of our live guests, and also those of you who will be seeing this webinar later on. So it's a pleasure to give you a short overview of what AutoPiX is about before we start to elaborate on the unmet needs and why we thought that developing this project makes sense. So AutoPiX is a consortium, so it's consisting of several different partners. These are academic organizations or institutions like universities, also members of the pharmaceutical industry, medical technology industry, patient research organizations and patient research partners, and also regulators. And we have a total of 20 such partners representing 10 countries. And within AutoPiX, our ambition is to collect data, mostly images, but also other kinds of data linked to images from over 90,000 patients with arthritis. So if we are successful at doing so, this will be the largest collection of such data in Europe and probably also around the world. AutoPiX will also include, in addition to collecting this immense amount of images, also 7 smaller clinical trials. And for all of this, received funding of about 21 million euros from the European Commission and also from the industry. And it is a project that was launched in November of last year and will last 5 years. So the aim of AutoPiX, and I alluded this already to this already in in the first slide, is to find out ways how to better use imaging tools, using also artificial intelligence to better diagnose, monitor, and treat arthritis. The imaging tools that we will be mostly using within the project are the so-called conventional imaging methods, which everybody who has had one or another imaging examination in the past, either for a rheumatic condition or any other condition, will be knowledgeable with. And these are conventional X-rays, ultrasound, and magnetic resonance imaging, or MRI. And we'll use all these methods to provide a more personalized and precise care for our patients. The 3 diseases included in this basket group of inflammatory arthritis is rheumatoid arthritis, which is a symmetrical arthritis involving the small joints of the hands in particular, psoriatic arthritis, which is an arthritis which very commonly develops in patients who suffer from skin psoriasis. And this is typically, or maybe asymmetrical, can involve the spine, and it may include large and small joints as well. And then we have spondyloarthritis, which is a form of arthritis that is particular for the spine, which can involve any segment of the spine. And these 3 diseases in total affect almost 100 million people in Europe. So over the pathway, a typical path of a patient with arthritis, it's regardless of what arthritis in particular we're talking about. So what is common to all of these patients is that they will typically be seen in the earliest in the community setting when they are perhaps at risk of developing disease. Maybe they have family members who've had that disease, or they might have even some tests done which revealed, for instance, the presence of antibodies, which are put them at risk, or would have skin psoriasis, which I mentioned earlier, which also puts them at risk. And then in these situations, particularly when the first symptoms, joint pain, is noticed or detected, then imaging examinations are very commonly performed. And these may include, again, X-ray, ultrasound, or in case of the spine, MRI. When patients get the diagnosis of an early arthritis and later on proceed to having an established disease, which means that the disease has been established by a specialist, then these imaging examinations will occur either regularly, at the case of X-rays, or for ultrasound and MRI at certain time points when the physicians are either in doubt of whether they have the right diagnosis, but also more commonly when they want to know whether the medications, the treatments that they're providing, are they working or not. So that's also a good time point to do these examinations. And then in patients who have long-standing disease, they may develop other involvement, perhaps other regions that were not involved before, or maybe they were responding well to a drug, but then that drug ended up not working so well. And so then you do imaging again to make sure that there's really inflammation going on, which you want to treat, or something else. And for all of these purposes, you will do various imaging techniques. Now, for those patients who are in clinical trials, and these are randomized studies, which are, of course, very important when we want to test new medications, imaging is also a commonly performed assessment. So it's a commonly performed examination, again, to check whether those medications are working and they're really preventing the inflammation of the joints and the destruction, the structural damage to the joints, which is a consequence of the inflammation. And then in the trials, the images will perhaps be smaller in number, but they will be taken at very standardized time points, which is perhaps a bit different than what happens in clinical practice. Now, all of this leads to a huge number of images generated, of course. And the problems with this medications from a physician perspective or doctor's perspective is that, first of all, these images have to be evaluated, or are typically evaluated these days, by radiologists. And there's, of course, a huge lack of radiologists. In total, they have very high educational demands. And of course, it's very timely to look at images and generate reports. There is also a restricted access to many of these imaging techniques, perhaps not regarding X-ray, which is typically available, but ultrasound and MRI are usually not available everywhere in every setting. Then we have also data management and storage challenges. These large images need to be stored. And the attempts at solving these bottlenecks, which have been typically considered a pathway for artificial intelligence, these models that have been developed are currently limited to single centers and very small data sets. And these are some of the challenges that we want to overcome with AutoPiX. What happens right now, if you think of an imaging examination that perhaps you had already performed on you for any reason, it doesn't necessarily have to be an examination for arthritis. These typically get transformed into a narrative report, which means that a radiologist describes the images that they see, which of course is very valuable, particularly for clinical practice. But this leads to a situation where the patients are often confronted with these reports and they don't really understand the language. And quite often doctors are also perplexed with these reports, because these are either very specific and technical and very often do not provide a quantitative information. They don't answer the simple question, did the changes become worse or did they become less? So much of the data, which is in the images themselves, the pixels, is not well used. Is to make better use of this data captured as pixels in these images. So AutoPiX in a nutshell will have two main pillars. The first of them is how to improve the imaging biomarker quantification. So an imaging biomarker is a score based on an image. So we look at the image and we see the various lesions and the findings, what's wrong with that image, and then we have to score that. And that, of course, again, takes time, particularly if it's humans who are doing this job. In order to improve on this, we will be collecting this very large amount of images that I mentioned in the beginning in a so-called data lake, which is a large reservoir for images. And these will be coming from two main sources. So they will be coming from all the academic centers, the universities who are participating, but also from the industry partners who will be contributing data, images that were collected in clinical trials. And we will use these two sources to fill the data lake and then use that to generate machine learning models, both for arthritis involving the peripheral joints, these are the hands, the feet, the knees, and so on, but also the spine. So with the first step in when we will ingest, take on these images in the data lake will be to make sure that we are able to recognize the correct images and also help the computer programs, the models who will be doing the scoring to know where the joints are. And so we will delineate those joints, help them visualize them and annotate them, which means that we will assign scores and labels to these joints. Then we will build machine learning models, which will either be a cross-sectional image-based model where we take a single time point, essentially a set of images taken at the same time point, annotate them using both the existing scores, which may be present or already existing, but also newly annotate, newly delineate the bone endings, show where the little holes in the bones are, which are very important in arthritis. And also with regards to the other imaging techniques, ultrasound and MRI, where we can also detect and look at lesions, pathological changes that are not structural damage, so they're not a loss of bone or cartilage, but all inflammatory in nature, and that will be the inflammation of the joint lining. And all of this we will be able to look at in these cross-sectional models and develop machine learning models which will be able to score this. Now, going further, we will also do longitudinal models where we have a time series. And again, that's one of the advantages of having a lot of data from the institutions and universities, where we have from the very same patient in several time points, imaging examinations taken along the patient's career. And we will use those models which we will train on these time series to be able to predict whether or not a patient will respond to therapy or whether or not they are at a high or a low risk of having a disease which is very active. In addition to that, the second pillar of AutoPiX will be examining more perhaps novel or innovative imaging techniques. So these are not the conventional X-ray, ultrasound, and MRI, but newer things. And different things maybe more novel things of how we can use imaging. So one of that is to take the imaging kind of out of the clinic and bring it closer to patients. We have applications which run on smartphones, which are able to use photographs taken by those smartphones in the patient's home of their hands and are able to visualize and detect small changes in the way the finger folds above joints look, and use that in addition also videos made of fist formation, of how easy it is for patients to form a fist, and you can analyze that using this app in the patient's phone, and that can provide information on whether or not they are developing a disease or whether or not their disease is stable or not. We can also do things again using smartphones, but attaching a so-called thermal camera to this. This will be done has an in-clinic assessment, so it will be happening when the patients come to visit the physicians, and that can be used to generate these images, heat maps, which can again provide information about inflammation. Now, in addition to this, we will also be looking at ways of how to improve already existing techniques such as ultrasound, which again requires a lot of time and effort from the sonographers, the physicians, and healthcare professionals who do these examinations, the scanning, and then score. And there is a very exciting robot within the AutoPiX consortium, which is now deployed in several centers, and this robot will perform the ultrasound examination without any need for intervention by a physician or a nurse. And the patients are instructed of how to place their hands, and the robot does the scanning, and it also examines and scores the images. And in addition to that, we will also be looking at other more novel ways to characterize arthritis using nuclear imaging-based techniques and tracers. All of this we are doing, again, to impact patients on the long term. And in order to achieve this, it was very important to involve patient research partners and, again, the patient perspective from the beginning. And this was also a great learning process for us, and obviously ensured that AutoPiX becomes a successful project going forward. In addition to our patient research partners, we also engaged other relevant stakeholders, including the regulators, who are also part of the consortium. Because maybe just one last bit, Francois, because it is, of course, important going forward as we develop these machine learning algorithms, which, again, we hope will improve the way we use imaging to diagnose, monitor, and predict patients. And obviously, if we're ultimately successful in that, then that would allow us also to approach the regulating agencies using these new algorithms with the hope of bringing them closer to acceptance in routine clinical care.
Thank you so much, Peter, for that insightful presentation. It is now time for us to shift our discussion segment in which we will explore more of the reason of being for this project from multiple perspectives. And we will do this together with our guest, Peter Böhm, a patient research partner for the project, and Rob Janiszak, our project leader from Johnson & Johnson Pharmaceutics. Peter Böhm, I will let you lead us from here and bring us your patient perspective. Over to you, Peter.
Thank you, Francois. I will give some of my thoughts regarding the patient perspective on AutoPiX. First of all, I think there is the possibility for a big potential benefit for patients. For instance, in minimizing the diagnostic delay. We have a big diagnostic delay in inflammatory rheumatic diseases. And in my disease, axial spondyloarthritis, there is a delay from about 3 years between the onset of the first symptoms and the diagnosis. And this could be improved very well by the results of the AutoPiX study. There is a potential big chance for an improvement in this. And the earlier the diagnosis, the better the possibility and the options for treatment. And also another potential benefit is in the better disease and treatment monitoring. For example, what we already heard, the use of apps for remote monitoring with the help of AI, and also the use of artificial intelligence for assessing images. So we can get a better disease control and also for this a better treatment. But there are also challenges, risks, concerns that patients may have about all this. In first line, regarding the data protection and data security, we have a really big amount of patient data going into this project, into this data lake we heard from. And how can we be sure that this data is really protected and secure and cannot be abused by someone else outside the project and cannot be identified as personal data from patients. This is a concern of patients. And there also are patients with a lack of trust in artificial intelligence, in the use of artificial intelligence. So can we really be sure that the AI models assess our images in a correct way? Is there a risk for a false diagnosis or for overlooking symptoms so that we don't get our diagnosis? And wouldn't it be better to let all this assessment in the hand of the physicians instead of AI? I think we have to convince patients about this, that there is a trust, but there are these concerns. And also there are some potential issues for patients participating in the clinical studies, for instance. There may be patients with a lack of digital skills, so that they cannot use the devices for the remote monitoring in the right way. And also patients with limited physical ability because of the disease. If you have pain in the hands or deformed finger joints, all this, maybe you cannot take pictures of your hand and have problems to use the app for the remote monitoring. And also there may be a lack of access to devices for socio-economical reasons, for instance, or also a lack of access to internet, to the World Wide Web, for problems with connectivity. And one last point I want to mention is not on the slide, but we patients gave a lot of data in this project in AutoPiX. And how can we get information what happened with this? Information about the results of AutoPiX when it ends. Will there be a presentation of the results in a lay understandable, patient understandable way? And how can we access it? Will there be, for instance, a homepage for lay public and for patients to see what happened with the studies and with all this data? What are the results? What are the outcomes? This is also a question interesting for patients. And now I will hand back to François.
Thank you very much, Peter, for your very important points that you just raised. I turn back to you, Rob and Peter, if you want to answer some of the points that Peter just raised. Would you like to comment?
I mean, maybe just a quick comment, just to completely agree that how critical it is that we do in fact do what you were saying, is at the end of it and during it, present some of the results and make it in a way that's understandable to the broader public.
Mm-hmm. Thank you, Rob. Okay, but be sure, Peter, that we will for sure consider all the points that you have raised, and we will follow them up on a regular basis within our project. Especially, I'm thinking about data protection. Indeed, the data of the patients is, of course, at the core of our mission in AutoPiX to make sure that, and I think we need to provide more transparency about how we will do this so that it's no longer a question mark for the patients. I think that's very important, a very important objective we need to achieve. Okay, if there are no further, Rob, would you like to add something?
Oh, I was just getting ready.
All right. Sorry for that. Thank you so much, Peter, for raising all these very important points that we need to keep in mind as we continue further along AutoPiX. And now I would like to hand over to Rob, who will give us his perspective from the industry partners. And I will switch the slide in a second. Here you go.
Great, thanks so much. So Peter already highlighted earlier several ways that AutoPiX will deliver valuable new tools for measuring structural damage and inflammation in arthritis using imaging, as well as some novel digital tools to better understand the impact on patients. For the industry perspective, I was going to focus on just one particular example, I think, where AutoPiX has the potential to transform how we run clinical trials. So currently measuring structural damage and the inhibition of structural damage requires very large trials. This is due to several factors: the slow progression of structural damage, modern patient populations who are treated earlier, and the relatively short time patients can ethically remain on placebo. As a result, only a percentage of patients in trials exhibit any measurable changes with the current scoring methods, which means we need large trials and sample sizes to detect those differences. These large trials come with significant challenges. They have long enrollment periods to recruit enough patients. They're costly to execute, and they place a substantial burden on both patients and researchers. Ultimately, this slows down the process of bringing new treatments to patients. Regulators, including the FDA and the EMA, have recognized these challenges. On this slide, you'll see an excerpt from the EMA guideline for rheumatoid arthritis, which highlights the difficulties of measuring structural damage using the current scoring systems. And importantly, the regulators have expressed an openness to exploring alternative approaches. Conversations with regulators have also underscored the critical role that a consortium like AutoPiX can play in achieving a regulatory accepted alternative to the existing scoring system. So how can AutoPiX help? First, around generalizability. As mentioned, AutoPiX will be creating a data lake that will contain images from multiple pharmaceutical companies and clinical partners. This will ensure that the performance and the insights are robust across a diverse data set. Around collaboration, AutoPiX provides an important framework for sharing algorithms across the partners. This will enable us to collectively identify and advance the best performing algorithms rather than working separately in silos. On the clinical validation front, the data lake, enriched with the long-term follow-up from our clinical partners, will support clinical validation by demonstrating the relevance of imaging findings to patient outcomes. And importantly, and spoken a bit about by Peter, by fostering this collaboration across industry, academia, and patients, the AutoPiX will help build the trust in these algorithms as we gain more experience in the evidence and their utility. So in summary, I think AutoPiX represents an opportunity to leverage AI with a goal to reduce the burden on patients by enabling smaller, more efficient trials. It can accelerate the pace of clinical trials, making new treatments available to patients faster and at a lower cost of development. Thank you.
Thank you so much, Rob, for giving your perspective from the industry partners. Peters, would you like to react or ask a question or follow up on some of the leads that Rob just described? No? Okay. I believe, Rob, you were very clear and we got your message loud and clear. Okay, well, that leads us already to the end of today's webinar. But before we take off, I would like to first check quickly in the chat if there was any question. I believe we have no question at this point. So then I just want to finish by sincerely thanking you three, Peter, Rob, and Peter, for putting the effort of presenting these presentations and for being here today and for your insights and for the discussion that you triggered. I also want to thank to all of the audience that came today, attending, listening, and not submitting any question, actually. We hope that this session gave you valuable insights into why AutoPiX, why are we engaged in this ambitious IHI project funded by the European Union and by our industry partners, and the rationale behind this project. Please stay tuned for more upcoming PiXight webinars. The next one will be scheduled on November 11th. And we will talk about patient research partners, actually. This will be the main topic, and patient engagement. And please follow our AutoPiX social media channels and project resources to stay updated. And with that, I declare today's webinar closed. Have the great rest of your day, and thank you all for being here.